Welcome, everybody, to our Hurricane Preparedness Education and Training webinar. My name is Amanda Trish. I'm the Rural Health Development Coordinator here at Well Ahead, and I'll be facilitating today. We're going to start with a short disclaimer from LDH. The Louisiana Department of Health employees, contractors, affiliates, and others have no actual or potential conflict of interest in relation to this program presentation. The content herein is intended for general guidance, not as legal advice. Laws and regulations take priority if there are any differences. Only LDH's Secretary or Surgeon General can give official statements. LDH cannot speak for other government agencies, and if you need legal advice, you should consult a lawyer. Our objective today is to drive collaboration throughout the state that connects communities to tools and resources that can improve the health of our residents where they live, work, learn, play, and pray. And just FYI, we will have time for Q&A after our presentation from Dr. Winder. So if you would, please hold your questions till then. Now I'm going to hand it over to Nicole Coursey, Well Ahead's Deputy Director of Programs. Thank you, Nicole.
Good afternoon, everyone. I want to welcome you to today's webinar on hurricane preparedness. Now, Well Ahead Louisiana is the chronic disease prevention and healthcare access arm of the Louisiana Department of Health. Our vision is to reduce the burden of chronic disease and to assure access to quality health care for all Louisiana residents. We work alongside leaders at key organizations across the state, such as child care centers, colleges and universities, faith-based organizations, restaurants, schools, work sites, and healthcare facilities. We help to create environments in which everyone can be healthy. We believe that everyone has a role to play in connecting Louisiana's communities to a healthier future. We are committed to educating and empowering leaders across the state with actionable steps to move Louisiana's health forward. Again, welcome to today's webinar. I'll turn it back over to you, Amanda.
Thank you, Nicole. Now I would like to introduce our speaker for today, Dr. Sunday Winder. Dr. Winder has over 16 years of experience that includes emergency preparedness and response, community partnership building, policy development, research, and accreditation. She serves as the Executive Director of Public Health Preparedness within LDH, Office of Public Health. Previously, she served as the Deputy Director. Prior to these roles, she served as the lead for the Public Health Emergency Preparedness and Response in Louisiana, Region 1. She was responsible for assessing, planning, responding, and recovering from natural disasters, which we know include hurricanes and floods, accidental and or intentional release of infectious agents, hazardous chemicals, and or nuclear substances. Dr. Winder's works have included plan development, exercise planning and implementation, staff training and responses to Hurricane Gustav, H1N1 pandemic, the Deepwater Horizon oil spill, Mississippi River flooding, Hurricane Isaac, Ebola, the 2016 flood, Hurricane Barry, the COVID-19 pandemic, Hurricane Laura, Hurricanes Delta and Zeta, the 2021 winter weather event, Hurricane Ida, monkeypox, wildfires, the saltwater intrusion, Hurricane Francine, the New Year's mass casualty incident, and the 2025 winter weather event. She has extensive knowledge of the resources and capabilities of governmental and non-governmental organizations. Dr. Winder earned a Bachelor of Science in Biology Pre-Med from Xavier University of Louisiana, a Master of Science in Public Health from Tulane University, and a doctorate in Science and Mathematics Education from Southern University A&M College. Thank you so much, Dr. Winder, for being with us here today.
Thank you for having me. And so I'll kick off today's webinar to share with you the top 10 threats in our state. So as was previously mentioned, I'm with the Office of Public Health, the Public Health Emergency Preparedness Program. And our program conducts an assessment every 5 years. It's called the Jurisdictional Risk Assessment, JRA. And every year, every 5 years, we pull together our partners in the public health sector, as well as emergency management, hospitals, and other community partners to identify our top risk or threats. And as you can see before you, for number one, it's hurricanes in our state. So we have 9 regions, health regions in our state, and want to just note that 7 of the 9 regions selected hurricanes as a number one threat. The 2 northern regions did not select hurricane. They're not on the coast. However, they know that they are sheltering regions, but the direct impact from winds, from hurricanes was noted in 7 of those 9 regions as number one. You can see other threats that we have in our state, but for today's webinar, we'll focus on hurricanes. And the title today is, Are You Ready? We know that we have hurricanes very often in our state, but are we ready? We've experienced some, but let's see how ready you are. Next slide. So hurricane preparedness, I want to start by just sharing some basic steps that you should think about. We are in hurricane season. Every year, we have hurricane season from June 1st to November 30th. And so when the peak season, so for our state, around the end of August, that's when we've seen those major storms, those catastrophic storms. Before we get to that peak season, even though we're in hurricane season now, you still have time to prepare and want to mention some steps to think about. So as you're preparing for this hurricane season and those to come, make sure that you know your community's emergency plans, know the warning signals. At the local level, are there systems in place to automatically notify you, or are there systems that you have to sign up for to get notifications? Know evacuation routes. Know if there are shelters in your location. Will Red Cross set up shelters pre-storm or post-storm? Identify potential home hazards. So as you're developing your plan, you're developing your kits, know that you need to be aware of the hazards that may specifically impact your home. As you're thinking about your planning and your process, know that if you're leaving, you may want to turn off power, electrical, and utilities if you have time to do so. So some things to think about. Turn off gas and water supplies before you evacuate, if you have to evacuate, especially if you live on the coast, or if those your patients, your clients that you work with live on the coast. Secure structurally unstable home or building materials. Fire extinguishers, do we all have those? Do our family members know how to use them? Locate and secure your important papers. And so we talk about having things in place readily. Make sure they're in containers that are waterproof. We have new policies. We know we need an ID. Do we have a real ID if that's required? So those are things to think about to have readily available. Post emergency phone numbers at every phone. So if your facility have phone landlines, or if at home you have phones, make sure that you have a printed list of phone numbers. If you rely on your cell phone to call people, you may want to print some numbers, because oftentimes we do not remember those numbers. So have a list of numbers you can reference. Local authorities, special needs, so inform them if you or someone in your community has special needs, if they're bedbound, if the only way they can evacuate is by special transportation like an ambulance, we need to let the local authorities know. And so each of our 64 parishes, there are local offices of Homeland Security and Emergency Preparedness, and you can inform them if special transportation is needed simply to leave your home or someone that you know home. Make plans to ensure that pets can be safe. And a resource to reference as you're planning, as you're thinking about preparedness, is ready.gov. Next slide. So I want to talk about if there is an order to evacuate, as well as if there's not an order to evacuate. So first and foremost, if there's an order to evacuate, never ignore that. If decision makers pull that trigger, then it is important to listen and to leave. If a hurricane warning is issued for your area or you are directed by authorities to evacuate the area, a couple things to keep in mind. So take only the items that you need. If you're relying on government transportation, for example, there's not a lot of storage, there's not a lot of space. So make sure that you bring with you the things that you really, really need. If you have time, again, turn off things at home, turn off your gas, turn off your electricity and water. Disconnect your appliances. So this is helpful to reduce the likelihood of electrical shock when power is restored. Make sure your emergency kit in your car is ready and follow the evacuation route. So sometimes there are roads that are closed, but know that if it's an evacuation route, you can continue to travel that way. So know those routes and practice those routes, even if it's, in your mind. Next slide. So if you are not ordered to evacuate, if you have to shelter in place, you will need to ensure that you have a plan for that as well. And so as far as injuries, a lot of times we see injuries during the storm from things that were not properly secured. Or post-storm, we see injuries in the recovery phase and, stepping on broken things, for example. So want to make sure that things are secured if you're staying home. So to get to be the safest, a couple tips to share. Want to first make sure you have awareness. So you want to monitor the radio or television for weather conditions, if possible. We know that there are power outages. You may not have access to a television, but do you have a backup battery-operated radio? So that's something to keep in mind. Stay indoors. And so if you are sheltering in place, stay indoors. You may think that the storm has passed, but the eye may not have passed you yet. So you're listening to the radio, listening to where the storm is, and you want to stay indoors and make sure you're not putting yourself at risk by going outside prematurely. Stay away from windows and exterior doors. Seek shelter in a bathroom if you need to. Bathtubs can provide some extra security there. Prepare to evacuate to a shelter or to a neighbor's home. And so it's important to know your neighbors in case you need to identify a safe home in your community. Next slide. So this slide just want to remind everyone to have a family plan. Make sure that you're writing down phone numbers. Make sure that you have a meetup location for your family members. And so a plan is it's awesome, but also make sure that you're having conversations with your family members and make sure everyone is aware of that plan. Similar to what I talked about, things to put in your kit, you want to make sure that you have insurance information as well in that your family plan. Next slide. So plan. It is important to plan for hurricanes if you live, work, play in Louisiana. And so a couple things to be reminded of is to be knowledgeable about your role and know the expectations of you during a response. Involve your family in the plans that you have for you and your family. If you're working, make sure that your family understands that you're working. If you work in a hospital or a rural clinic, that's a rural hospital, make sure that your family knows you respond. And so make sure that that plan is clear when you're working long hours, maybe 12-hour shifts. So those conversations are so important. Make sure you have a plan for childcare while you're working those long hours, as well as pet care. Develop a home safety and evacuation plan and review and practice it. Again, practice can be a discussion, sitting around a table talking to your family. Gather emergency supplies. Some of those basic things we always remember, food and water, but we also need to remember things like first aid kits, a battery operated radio, flashlights, extra batteries. And I'll go through more details of a kit in just a second. Prepare an emergency bag in advance. Don't wait until the peak hurricane season to have a bag for you and your family. Create that bag and know where it is and have it readily available. Next slide. So this is a list of basic emergency supplies. And so some of these are known. Everyone's going to put those items in their kit. But some we just have to be reminded of. So water, we absolutely need water. We need water for ourselves. We also need water if we have pets. Make sure you include them as a family member. It's recommended to have 1 gallon per person for about 3 days. Again, this is for drinking and sanitation. You will also need food. So if power goes out, make sure that you have non-perishable food. Battery-powered radios. There are also special National Weather Service radios, NOAA radios, that can be purchased. Flashlights, but extra batteries, first aid kit, a whistle in case you need to call for help. Dust mask. So after a storm, you may need to clean up and have a mask on. Plastic sheeting and duct tape. And so if your windows are damaged, for example, you may need to cover that. Moist toilets, garbage bags, and plastic ties for personal sanitation. A wrench or pliers to turn off those utilities. Manual can opener. This is one I had to remind myself of a couple years back. We all like those those electrical can openers, but if you have non-perishable foods, canned goods, make sure you have a manual can opener as well. Local maps. We get so used to our phones and maps on our phones, but if those go out, if you don't have backup batteries for those, and you need to evacuate, you may need a physical map. So that's something else to keep in mind for your kit. Cell phone chargers, of course. Those batteries do not last as long as they should. So a backup power pack is also helpful for your kit. Next slide. Additional considerations, want to highlight a few things. So hand sanitizer, of course, you want to be as sanitary as possible. Disinfectant wipes are things to have in your kit. Prescription medication. So make sure if you hear those warnings or watches that you are filling your prescriptions. Non-prescription medication, make sure that you have that readily because it's stores may not be open and lines may be long. And so these are things you want to make sure you have readily. Your glasses, as well as if you wear contacts, contact solution, make sure you have enough for a few days. For babies, of course, we want to make sure that they have the formula they need. We talked about water. Of course, if you're using formula, you need more water for that as well. So keep that in your planning. Diapers, things that babies need, pet food and water, cash. So this is one in that warning phase. For example, you want to make sure that you have cash. Traveler's checks, that's another option, not as common now that we have debit cards and credit cards that a lot of stores will accept, but another option could be traveler's checks. Important family documents, again, make sure you have your insurance policies, your bank information with you in a waterproof container. So post-storm, you may need that. Sleeping bag and blankets, changing of clothes, that's something that everyone typically remembers that maybe the first thing you have in there, some clothes to change into. Fire extinguisher, matches, feminine supplies, mess kits, paper and pencil. Now, if you have kids or you may have older adults too that need entertainment. And so books, games, puzzles, activities, those are very helpful during response. And so for children, you want to give them some normalcy. Their devices may not be working. So let's make sure in those kits we have things to keep them occupied as well. Next slide. Older adults. And so older adults, some reminders we have for them, of course, medications. We want to make sure they have those with them. Storms past, we've had older adults that have left their medication. They get to a shelter and we have to quickly get medication refill for them. So reminder, pack all of your medication, have that in your go kit. doctor's phone number is important for individuals to have. So this is for you, but also for the clients you serve. Want you to make sure that the clients you serve are also prepared. Medical assistance devices, important. A number of residents in Louisiana are on oxygen. And so in addition to oxygen tanks, but those concentrators, they may need to bring those with them. Stand with another family member. Don't forget to bring everything that you use to sleep at night, for example. A copy of insurance information, can't say that enough. Next slide. Additional considerations for our older adults, determine any specific assistance needs and include plans for that assistance in your emergency plan. Remember, plan. Create a support network of family and friends and others to assist. Practice their emergency plan with their support network. Appoint a point of contact, inform the point of contact of the location of those emergency supplies, and ensure they know how to use life-saving equipment or administer medication. If routine treatments are administered by a clinic or a hospital, identify backup service providers. Remember, pets are service animals, so plan for an alternate plan for them. Some places accept those pets within the shelter, or it may be a nearby location. And so want you to know that, keep that in mind. Next slide. So this is a little bit more about the types of shelters. And so I alluded to, there are shelters where individuals may be able to keep their pets with them, but there are some that the pets may be in a nearby facility. So in our state, we do have various types. We have the animal-only shelters. So keep that in mind. You and your animal may be in different locations. We have co-located shelters, but that co-located location could be adjacent. And then we have cohabited shelters. From a medical standpoint, we have medical shelters, and we have a policy of service animals are allowed, but not other pets. Next slide. Prescription refills, I want to make sure that we remind everyone to get their medication before storm. Next slide to go into a little bit more about prescription. So when there is a state declaration, the pharmacy board will send a reminder to pharmacies to let them know that under this declaration, individuals can get 30 days, a 30-day supply of their medication. And so this is regardless of the payer, regardless of the insurance type. Specific for Medicaid, again, if there's a state declared emergency, our Medicaid recipients, they will get a notice advising that co-pays are waived and that early refills are allowed. The notice will include instructions needed to override rejection codes, so pharmacies will get that notification. Private insurers, the pharmacist can contact the support desk for instructions for refilling those prescriptions early. So we do have a focus, want to make sure that everyone knows, refill their medications, and under a declaration, you can get additional early refills and additional days of medication. Next slide. In our state, we have medical needs shelters. Next slide. So in our medical needs shelters, these are shelters that provide a safe location to individuals who may not be eligible for a general shelter because of their medical needs, but they're not sick enough to be in a hospital. The care provided is limited and available until the end of the emergency. Individuals who are eligible for admission should have a caregiver. We do not turn anyone away if they do not have a caregiver, but caregivers are encouraged in medical needs shelters. Next slide. So during a response, if you're in an active hurricane or right after the hurricane and you're looking for a shelter, an easy number to remember is 211. And so they will have a list of the various types of shelters, those that the parish may have opened or the state opened, or a nonprofit has opened, a church has opened. If there's a need for a medical shelter, there are keywords, and they can transfer you to a triage line that can help accept you or get you accepted into a medical shelter. So 211 is an easy number to remember to know if there's a shelter in your location. Next slide. So here's a list of the various types of shelters we have in our state. So I mentioned medical needs shelters. Again, those are for individuals that have medical needs. A similar type of shelter is called a federal medical station. This is a location where our federal partners can provide us with additional medical supplies and equipment and staff to augment those state shelters. So if our state capacity is exceeded, we can ask for federal support in the form of federal medical stations. There are also critical transportation needs shelters, C10Ss. And so these are shelters for individuals that do not have a means of transportation to evacuate. And so they not only need a shelter, but they need transportation to that shelter. So to get to a transportation needs shelter, there are bus stops that individuals can go to, and then they're transported to what's known as a pickup point, and they're taken to a shelter out of that particular parish. There are also general population shelters that Red Cross may run, parishes, or faith-based organizations. Want to mention there are specific shelters for sex offenders. They are not co-located in these other shelters, and so there is a sex offender shelter. Unaccompanied minor shelter. There's also a shelter if a minor doesn't have a parent or a guardian. There's a shelter for them. And again, pets. We highlight pet shelters because one of the gaps, the issues we saw from, let's say, 20 years ago, Hurricane Katrina, was people did not evacuate because they could not take their pets with them. So they stayed behind because they weren't sure. It was unknown if there was a place for their pets to go. And so now when we're educating, we want folks to know you do not have to stay behind because of your pet. There is a pet shelter. It may be adjacent to where you are. It may be co-located with you. And I believe that is my last slide. Yes. So if there are questions, I'm here to answer any questions.
Thank you so much, Dr. Winder. As you mentioned, at this time, we will have our Q&A segment. So anybody feel free to drop your questions in the Q&A box and you will be acknowledged by one of our team members. Please do remember though that for all medical questions and or advice, please consult your physician. In the meantime, Dr. Winder, while we're waiting for any questions from participants, I do have a question. How can neighborhoods and communities work together to improve hurricane preparedness and response?
So it is important to know your neighbors, know your community. And so getting to know them is important so you can identify who has certain challenges. I alluded to earlier, individuals may be bedridden. And so if you are someone that's not bedridden, knowing your neighbors that are, you can check on them, make sure they know who to contact if they need to be evacuated or need other resources. So knowing your neighbors on the preparedness side is so important. Know what their needs are. When there's a hurricane, there's a potential for flooding. You may have to prepare your home or help your neighbor prepare homes. I've seen a number of communities help with sandbags, picking up sandbags for their neighbors, placing those sandbags in the appropriate places for their neighbors. So knowing your neighbors to help you with securing your home is important, or to evacuate. Again, everyone may not have transportation. You may be able to carpool. So knowing your neighbors is important for that. I'll mention on the response side too, individuals that may have dependence on electricity for medical needs. Everyone may not have a generator, but if someone in your community does, you can stay home and identify someone with a generator to charge your device or charge your battery. And so sometimes the evacuation orders are not issued and there's still power outages. And so having those neighbors that you know, community members that you know, it could be life-saving.
Thank you. And we do have another question for you. Can you explain the difference between a hurricane watch and a hurricane warning, and what specific actions should be taken for each?
Yes. So a hurricane watch. So a watch is issued before tropical force winds hit the coast. A watch is about 48 hours before those tropical force winds hit. And those that wind speed is about 74 miles per hour. So you're watching before the winds hit, about 48 hours out, to know that a storm is possible. And so it doesn't mean it's going to happen, but it's definitely possible. And so at that time, you should definitely make sure that your plan is in place. And if your kit, you have a kit. And if you need to evacuate, again, play in your mind, what's the evacuation route? Where am I going? Also very important, those radios are listening. So at this point, you will likely have power. So listening to local officials, listen to the weather. So keep that throughout the time of a watch or a warning, know what the weather expectations are. So that's a watch. So that's about 48 hours before you are still not sure if it's going to impact your specific area. It may be coming somewhere, but is it your specific area? Still some unknowns. But a warning is something that is more reliable, and it is saying that a hurricane is expected. And so again, winds are the same, 74 miles per hour. That's a Category 1 storm. So you want to make sure that a warning you're listening to and your plan is complete. You've already talked about it with your family members. So now you're about 36 hours out from tropical force winds. And someone may tell you to evacuate. And if you have to evacuate, do it. So both a warning and a watch, you want to make sure that you're listening to the local officials, because they're really trying to narrow down the specific location that the storm will be directed towards.
Thank you so much, Dr. Winder. We really appreciate you being here today. I certainly feel more educated as far as hurricane preparedness goes. Now I will hand it back to Ms. Nicole for some closing remarks.
And thank you all for joining us in today's wellness webinar. We hope you're leaving with valuable insight and practical tools to enhance your well-being. Now, remember, wellness is a journey, safety is a journey. Small, consistent steps can lead to meaningful change. Stay mindful, prioritize self-care, and support one another in this journey. If you have any questions or need further resources, please feel free to reach out to our team. Stay well, stay inspired, and we look forward to seeing you at future sessions. Back to you, Amanda.
Thank you, Nicole. Again, we thank you all for joining us today, and a huge thank you again to Dr. Winder. Like I said, we're definitely walking away more educated and empowered. Everybody, to find more out about Well Ahead and our numerous programs and services, please visit wellaheadla.com, or you can contact us at wellahead@la.gov, or you can give us a call at 1-844-522-4323. Thank you, everyone.